Good morning, friends. I'm Dr. Meghna Ved. I'm a consultant homeopath and a backflower therapist. And today I'll be talking about heel pain. Right? So it is very common in ladies, especially between 40 to 60 years of age. And the most common cause of heel pain is plantar fasciitis. Now, plantar fascia is a tissue that connects our ankle or heel to the toes. Fine. So the entire tissue, whenever it gets inflamed, it leads to severe stabbing pain. So that is one of the reasons, most common cause of heel pain. Fine. So what happens in heel pain? You can have sudden stabbing pain, especially while there is change of position, when you are sleeping and getting up first thing in the morning, or when you are sitting and then getting up, you find difficulty in walking for a few minutes. So that sharp stabbing pain is there. Okay, that is because of plantar fasciitis. Second is you could have a dull aching pain all throughout the day. Okay, so these are the symptoms of heel pain. Now let us talk about the reasons. One of the most common reason is you are not using proper fitting shoes. If you are using shoes that have soles that are hard or poorly fitting shoes, then it can lead to heel pain. Second is if you are overweight. If your weight is on the higher side, it's obvious the excess amount of weight is going to fall on your heels and that can cause heel pain. Third is if you are having deficiency of certain minerals like calcium, magnesium, vitamin D and vitamin B12. If you are having deficiency of any of these minerals, it can lead to heel pain. Fourth is if you are not having proper amount of fluids, if you are dehydrated, then obviously the lubricant fluid that is present in the heel will be depleted and that can lead to damage to the bones of the heel and that can lead to heel pain. Okay. So these are the common reasons, and it is very common also in people who are involved in professions that involve standing for long period of time, like in policeman, or if you are working in a mall, or if you are working as a teacher. Now these professions involve standing for longer hours, 5 to 6 hours in a day you are standing, then that is going to cause heel pain. Okay, so these are the common reasons of heel pain. Now let's talk about what can be done about it. First is if you are having severe heel pain, it's important that you take proper rest. This plantar fasciitis is not going to get resolved in a day or two. It takes around 2 to 3 months to subside, for the inflammation to subside. So it's important that you take proper rest whenever you are having this pain. Second is you can do taping of the foot. Put tapes on the arches of the foot. Arches is that that arrow shaped bend in the foot. You put tapes on it and then you can walk. That will help in relieving your pain. Third is put ice pack. Fine, you can put ice cubes in a polythene and then put it on your feet twice in a day, 10 minutes twice in a day. Ice pack can be applied. Fourth is you can also use hot water therapy. Take some lukewarm water and you can add Epsom salt or pink salt in it and soak your feet in it for 10 minutes twice in a day. Then what you can do is do exercise of the arches, and simple is you can use a simple ball, dancing ball, soft ball is available, and roll it in the foot. In the arches of your foot you have to roll that ball twice in a day, at least for 10 minutes. That will help in reducing the pain and inflammation. And fifth is you can use, there are heel pads available, so you can put heel pads on your feet, or ankle splint or heel pad. You can find it in any pharmacy, and you can use that temporarily. Okay, so these are the things which you can do. Now as per diet is concerned, you have to take diet that is rich in calcium, magnesium, omega-3, vitamin D. So include more amount of nuts and seeds in your diet. Include pumpkin seeds, flax seeds, sesame seeds, white, that is white sesame seeds. Use melon or sunflower seeds. Include nuts like pistachios, cashew nuts, walnuts and peanuts also. So include nuts and seeds in your diet. Also increase the exposure of your exposure to sunlight. So it's very important to expose yourself to sunlight at least 20 to 30 minutes, especially in the morning, okay, to get sufficient amount of vitamin D. And also include fruits that are rich in vitamin C, like tomatoes, kiwi, oranges, because these fruits help in reducing the inflammation. Okay, so these are the changes which you can do in your diet for reducing heel pain. Now, let's talk about homeopathy line of treatment. First remedy which I am using is Ruta. It is a very good remedy for inflammation of the tendons. So, Ruta works wonderfully in treating heel pain. Second is Ledum Pal. If you are having that typical sharp stabbing pain, you know, as if there is a needle in the foot when you get up in the morning and it's totally impossible for you to walk, then Ledum Pal works wonderfully. Third medicine is Arnica, which I usually use in people who are involved in professions that involve long standing, like teachers or policemen or people working in malls that have to exert their foot whole day, right? Those who are undergoing overexertion, then Arnica works wonderfully. Fourth remedy which I use is Calcarea Floor 6X. I usually give along with the indicated remedy. I continue it for 1 to 2 months, gives wonderful results in heel pain. Calcarea Floor 6X, because it helps in restoring your bone and tendon health. So this has to be given along with the main indicated remedy. Other remedy which I use is Lycopodium. It is a beautiful remedy if you are having that typical pain as if you are walking on stones. You know, especially in the morning, you feel as if you are walking on stones and the entire bottom of the foot is paining. Then Lycopodium works wonderfully. And the most common remedy which I use, especially in menopausal women or in and those who are slightly on the heavier side, slightly obese women suffering from osteoarthritis, having bone pains, then I use Netrum Calm. Netrum Calm 200 single doses weekly I give along with these indicated remedies. It helps in restoring the bone health wonderfully. So these are few of the remedies which I have been using with wonderful results in heel pain. But the remedies can be given only after taking proper history of the patient and after consulting a homeopath. So stay confident, move freely, choose homeopathy. Thank you. And if you have any queries related to heel pains, then I would be happy to solve it. You can send your queries in the comment section. Thank you. Take care.